for under $200 a month. Visit VWDealer.com today.
Hey, I put some new shoes on and suddenly everything's right. I said, hey, I put some new shoes on and everybody's smiling.
Yeah, I noticed that Casey McDonald, our traffic human, she'll immediately get out of her high heels and go right to the flip-flops.
Sure.
But here's my, I have a couple questions for Jen.
All right.
Why are mules called mules, the shoe? And is a mule safer than a flat?
A mule, I don't even know what a mule is. I don't know
Don't they call
if
them
that's
mules?
like some...
Type of shoe, isn't it?
Is it a shoe? What does it look like?
Mule.
I don't know what that is. Do you know what that is?
Yeah.
No,
yeah.
We don't know that.
I
Okay, but look it up and get back to us at the end of the segment. So the first question we have for you, Mike Jarek, if you get a blister from your flip-flops, do you pop it or not?
Oh, I go right to a safety pin, heat it up, boil it in water, and then pop it. And I know it's wrong,
and then pop it.
but if it's there, I'm going to pop it.
Okay, and then do you okay, doctor, you say we can put a little pokey in.
You can poke it.
But you want us to leave that skin there.
Absolutely. You want to leave the skin on to protect the area.
It's weird.
It is weird.
But you say leave it on. You call it the roof?
The roof.
Okay. Again, good morning to your Cheerios. Now, of course, we want to protect ourselves from ever having that happen. So the first thing you say is?
Pick the right shoe, or the right flip-flop or sandal, however we're looking at them today.
Okay.
And that's extremely important because you don't want your foot flailing around.
And I shared with you, and everyone knows because I've talked about it 1,000 times, that I had my ACL replaced.
Yes.
And they said to me, you must wear flat shoes. And I thought they meant a flat shoe.
Right.
You prefer a shoe that maybe isn't super flat, but you love this shoe?
I like it. I like it. I tell you why. It has that metatarsal, the little cookie in the middle to support your arch. It conforms your foot into this nice little box right here, and it also has a heel cushion, so it helps control the heel a little bit. So it really cares about your foot.
And you even like this shoe. I asked about this what do you like about this shoe?
You know, same reasoning. Now, it doesn't have the proper arch support, but at least Dr. Scholl's tries to give you a little bit of cushion on the heel. You know, your little declination is a bit high, but it's okay. It has a soft cushion area for the balls of your feet, where women, you know, they develop those calluses on their balls of the feet, and they will love these, so feel comfortable. And it's also the material as well.
And, you know, we come into a store like DSW, and we want to buy everything, and even if it's not the perfect size, but you say go snug as opposed to going super loose.
If you want to reduce those blisters,
why is that?
Keep it nice and snug. Because if you don't keep it snug, your feet kind of flail around a bit, and you start separating. You can separate the skin layers, and that's what causes the blister.
Do you ever wear flip-flops?
I don't wear flip-flops.
You don't want people to see your feet?
I don't like my feet.
That is so weird. Okay, talk to me. You like this Nike flip-flop a lot.
I'm in love. Like I said, Nike loves your feet. I mean, you have cushion here. It conforms to the foot. It has these medial and lateral grooves that really just kind of control the action of the foot when you're walking. I mean, it's a soft, passive control, but however, it's still good. I mean, I assume your foot in this will feel like a dream.
Okay, we see these flip-flops all the time. They can be $1. They're sometimes. We did not buy these at DSW. You brought these from home.
Yes.
You don't care for these.
No, these are awful. I mean, they're you know, maybe we shouldn't show the name, but they're really bad, really bad. They're too flat, they're cheap, they're not worth your time. This is gonna fall out in a couple of wears, and it's just no good. There's no arch support. I mean, yes, there's some cushion there, but it's not, and your foot is obviously gonna flail around. There's no conformity there to your foot, and that's the most important thing when preventing blister and injury. 2
or 3 years ago, when I used to go get manicures and pedicures before I had 19 kids, I had a blister, and the pedicurist said, you know, your feet, they just weren't moisturized enough. Is there something to that? Like, should we be moisturizing our feet?
You know, as odd as it may sound, you actually can't, you shouldn't moisturize too much because that causes movement. So
you should not do that.
Right. You shouldn't over-moisturize.
But don't make them too dry either?
But don't make them too dry either, because then the skin gets tight and taut.
How do we know if we've done it too much or too little?
Just, you know, a little basic amount. Your feet should feel nice and supple.
Okay, and you say we should be treating our feet like we treat our face.
Absolutely.
And that means like scrubbing them every morning in the...
Absolutely. A light scrub, a light mask, things that you would do in your feet. Surprisingly, people should do with their things you do with your face. That's things they should do with their feet.
All right. So listen, you see a lot of patients down there at Dr. Maasi headquarters. I don't know where that is. Real quickly, as we wrap it up, if you see a lady in sky-high Dior stilettos, are you like, that's going to hurt your feet? Or no?
Well, I give him a business card. Figure you're going to be there eventually. We're going to have a conversation.
High five. And again, you can follow Dr. Maasi on Twitter, because he's Dr. Maasi. And he's still, you know, waiting for Chanel, you to hook him up with all the Facebook people.
Oh, there are plenty. And
yes.
at every moment.
A lot of women want to have avocado and honey rubbed on their feet by Dr. Maasi.
And he loves this place. He's been walking up and down the aisles of DSW going, ooh, I love these shoes. Ooh, these are great. Ooh, he says this is like a foot guy's dream is to walk up and down the aisles of this joint.
A foot guy's dream.
He said he wants them supple.
I know a couple of foot guys that need to be arrested.
Yeah.
No.
Mike is trying to make my feet supple.
Your feet are all cracked.
I'm not. Look at it, not cracked.
He does not like the cracked feet. Look at him. No cracked feet. Chanel?
Yes.
He does not like cracked feet. Do not go to his office with cracked feet.
Thank you. What are you going to do with all that lotion? You're not touching my feet. Look at his hands.
Okay, we have an update
Did you hear
for you.
Casey?
I know.
From way
Casey's
back,
getting
and she goes,
sick. Oh, you know
"Ew."
what? Can I tell you about this?
Yeah.
Because we love this family. This is
yes.
fantastic. And finally,